All right, good afternoon, everyone, and thank you all, of course, for being with us here today. I'm Becky Wydysh. I'm the chairman of the Niagara County Legislature, and speaking with me today, I have Sheriff Filicetti, Daniel Stapleton, Public Director of Health for Niagara County, and Jonathan Schultz, the Director of Emergency Management. First of all, let me start by saying that Niagara County still does not have any positive cases of COVID-19. There are no positive cases that have been confirmed in Niagara County as of yet. However, yesterday afternoon, we did see Monroe County announce positive cases and then declare a state of emergency. Neighboring Orleans County also then announced their own state of emergency. Late last evening, 3 positive cases of COVID-19 were confirmed in Erie County, followed by their declaration of state of emergency just this morning. If you were watching, they had a very comprehensive and educational press conference themselves. We thank them for that and getting that information out to the public. We'll be much shorter today and just give you our update here in Niagara County, but they did do a wonderful presentation. At this time, with our surrounding counties having done so, we feel it is the appropriate preemptive action to declare a state of emergency here in Niagara County as of 2 p.m. today. Declaring state of emergency allows us the authority and the ability to implement public protective measures and continue to receive state and federal resources should we need them. We know that coronavirus is moving in our direction and that we will likely have positive cases in the near future. To that end, I've been in regular consultation with our school districts, and they have made the following decision and given me a statement to read on their behalf. Niagara County has issued a state of emergency, and the Niagara County Health Department has recommended that all schools be closed for students effective Monday, March 16th and until further notice. Therefore, all schools in Niagara County will be closed for students beginning Monday, March 16th and until further notice. Districts will reassess student attendance weekly. Districts will be providing separate information on staff attendance, academics, and food service. At this time, it is not our intention to close county buildings as we do provide necessary services to our residents. We do, however, ask that everyone use good common sense and follow the CDC guidelines when you're deciding whether or not you should be coming into those offices, for your health and for that of our employees. Please remember that many of our services can be completed by a phone call or through mail, and we ask you to do that whenever possible. We also ask you to do that in other areas of your life. Take precautions where you can. When shopping, seeking entertainment, visiting friends and family, again, not just for your health, but for those who you might come into contact with who have underlying health concerns. Please again use common sense in deciding if you should be going out to those events or maybe staying at home. Governor Cuomo's executive order has already prohibited gatherings of 500 or more individuals and cuts in half the official seating capacities in places like restaurants, movie theaters, etc. We ask that our local establishments be understanding and that you follow these new mandates. We will continue to inform and update you as often as possible and ask your understanding, as this situation is evolving rapidly. I have every confidence that Daniel Stapleton, our Director of Public Health, and his staff, his whole team, are well equipped and working hard to keep us safe and informed. I'd ask Mr. Stapleton at this time to give us an update. Mr. Stapleton?
Thank you, Madam Chairwoman, and good afternoon to all of you. I'm going to make this very brief. I want to give you an update on where we are in Niagara County in terms of the cases. We have no positive cases in Niagara County. We have 12 individuals that are quarantined in their home. We have done a number of testings, and so far we do not have a case in Niagara County. But we're not waiting for a positive case to dictate what we do. We're looking at the science, we're looking at the facts, and we're making decisions based on conversations we have with our experts, and we'll continue to do that. We all know there's no vaccination for coronavirus, and the earliest possible date we're looking at is 12 to 18 months, more likely 18 months. Also, antivirals are not effective. Those hopefully will be available within 4 to 5 months. So because of those facts, and the science we're looking at, there are certain things you can do out in the public to make sure that you mitigate the spread of this virus. I talk about things like non-pharmaceutical interventions, NPIs if you will. Those are the things that we do every day in public health, and you should do as well. You don't need to wait until there's an outbreak of disease to take some of these precautions. So we talk about things like washing your hands. Not exciting, but the number one way to prevent the spread of disease when you have no vaccine available. And all of you can do that every single day, whether we have an outbreak or not. Other things you can do: avoid touching your eyes, your face, your ears, everything like this. The average person does that 90 times a day. You got to be conscious of what the actions you're taking and reduce those types of things. Avoid contact with people who are sick. If you're sick, don't go to work. Don't go to church. Don't go to those places you normally go during something like this. Common sense approaches, if you will. When you practice good hygiene, when you're sneezing, sneeze in the crook of your elbow. Use a tissue and throw it away after you use it. Simple things like that. Also cleaning and disinfecting areas where you come in close contact with in your home. If you go to work, don't expect someone else to clean your keyboard. Don't expect someone else to clean your phone. Do those things that you can do on a daily basis to reduce the risk to you and those that you love. Also, if you have symptoms consistent with coronavirus, which are identical to the seasonal flu, call your personal physicians before you go to their office. Do not go there directly. Talk to them. If you do not have a primary care physician or can't get a hold of yours and you're going to a immediate care center or the local emergency department, call them first. Don't go there. Don't go there and spread the disease that you might have. Simple things like that are really, really important. We are operating as if this coronavirus is already here in Niagara County. Once again, we do not have any positive cases. Well, we all need to do these things to reduce the spread. We deal with this every day. Count on your local health department to make sure that you and your family are safe. We're not new to this, so count on us to make sure that everything is taken care of. We're on top of this. I'd like to hand it now over to Sheriff Phil Seddy. Sheriff?
Thank you. Thank you. I just want to give you a brief update from the Sheriff's Office. First, I want to assure everyone that our patrol functions, our 911 center, our correctional facility are still fully operational and will continue to operate. Secondly, we do have one restriction in place at our correctional facility. There's no contact visits allowed. All of our programming has been suspended at the correctional facility, but we do encourage use of our video visitation and phone services. Effective Tuesday, there'll be a reduced rate for phone services to encourage that visiting privilege to continue. Obviously, the safety and health of our inmates and staff has to take priority with everything that's going on right now, and I want to make sure that we don't end up with something in the jail that we shouldn't have. I don't need COVID-19 in the correctional facility. With the declaration of the emergency, we'll continue to provide critical public safety. We're going to work with our law enforcement partners in the county here and our county officials to ensure the safety of our residents here in the county. As this situation progresses, there's going to be constant planning going on. It's a very fluid situation. We will update you the best we can from a law enforcement perspective of any changes of the law enforcement response within this county. I'll be in constant contact with the chiefs. We'll be working on that to make sure that there's a consistent law enforcement response within this county. And with that, I'd like to turn it over to Jonathan Schultz, Director of Emergency Management.
Thank you, Sheriff. A couple updates from an emergency management perspective and emergency services response. The one key element that's really come out and shown very well is the partnerships. The partnerships between the Sheriff's Office, Public Health, and many other agencies and working together, not only within our county, but crossing county lines and all across Western New York. How well we're all working together and bringing this the best benefit for all our citizens. The logistics and operations coming out of our facility right now are growing every day as more and more needs are coming up with our community. And our number one priority is to work with our first responders to take care of them, to make sure they're there to take care of those of you that might be sick or in need. So we're always working with them day and night to make sure that's all taken care of, as well as our doctor's offices, our nursing facilities, and also schools as well. Our emergency operations plans, our mitigation plans are in place and in full effect at this time. And we do have our emergency operations center operating. We do have it at a level 3, which is kind of a lower level at this point. Basically, we're doing a lot of operations, working with public health, and helping them to fulfill their needs and what they need to take care of our citizens here across Niagara County. I'd like to turn it over to Chairman Wydysh now.
Thank you, gentlemen, for the updates. Just a few more points I'd like to kind of bring up, things that have occurred to us or we get questions about quite a bit. I would say, folks, be careful about social media. While social media is a great way to get information across, we're live streaming, I believe, on our Facebook page right now for Niagara County. It's also a way that spreads misinformation and panic, unnecessary panic in these situations. Please just keep in mind, and I think they said it well in the Erie County presentation this morning too, if you see a post by a friend or family member, know that that is not necessarily true and accurate information. If you have questions, reach out to those that are in the know. Check our public health website, the Niagara County website, medical website, your own physician. We also have some phone numbers that you can call, but again, just keeping in mind that what you read, you need to get from a reliable source. We do have a number through the state that public health is using for people to call in with questions. That number is 888-364-3065. Also keep in mind, this can be a difficult time for people. We're going through something right now that most of us haven't had to deal with in our lives. And again, with the social media and easy access to information, people hear things. It can be upsetting. Some people aren't sure how to handle it. It can cause anxiety and other mental health concerns to worsen or become an issue that weren't before maybe. So also please keep in mind the county has a 24/7 crisis services line. That number is 285-3515, and the staff there is ready, willing, and able to assist you all day long if you have questions or concerns and need to talk. That's really all I have at this point. Again, our overall message, please just be mindful of where you're going, what you're doing, sticking to small groups the best you can. I did it myself. I don't know if you noticed as I was speaking, I did the, lick my finger, turn the page. And those are the things that we just do out of habit that we don't think about and we really need to start thinking about. As I was doing it, it hit me what I was doing. So just keep in mind, that you just need to really pay attention and keep yourself safe and healthy, and we're doing everything in our part. We have a great team here at the county, as Mr. Schultz said, all working together in collaboration with those outside agencies as well, the schools, the towns, the cities. We're all working together to keep our residents safe and informed. So at this time, I know you probably have questions. We kind of open the floor up to questions for any of us that are up here. Yes?
Is there any former medical sites that the county is looking at contracting with to perhaps turn into quarantine sites if ever need be?
We do have a few different options that we are exploring. There have been no contracts that have been signed as of yet, but that is certainly something that we know at some point we will likely need. So we are looking for those purposes down the road to make sure that we have the ability to house people if we need to. So again, no contract signed. I don't want to get into specifics until those are firmly in place, but yes, that is something we are absolutely working on.
What do you say to young people that won't be in school for the next week or beyond, as far as gathering, getting together, possibly going to the mall, things like that?
Sure. It's important to remember, I think Mr. Stapleton, I don't know if you want to speak to this more directly, but yeah, this is not fun playtime, go do whatever you want, that's for sure.
Well, what we recommend is social distancing. We're talking at least 6 feet away from the person you're interacting with.
Will there be any accommodations for some parents that might need childcare options during this time?
We don't have anything in place at this point, and do you want to speak to maybe some things you were hearing about at the state level, or are they still too premature?
They're very premature. That's one of the things that every school superintendent thought about a lot before they made this type of decision. We understand that these types of decisions put inconvenience people and make it difficult. But if we want to stop the spread of the disease and we're taking that serious, we need to take serious precautions, and that's why we're doing this.
Yeah, and of course we do ask parents to be mindful of the fact that we need our workforces intact as well. Many of those parents are also healthcare providers that we will need in the healthcare community helping us. So it's a delicate balance, and certainly something the school took into account and we as well worry about. So, one back here.
Should school faculty and staff still report?
Again, that is a question for the superintendents, but yes, at this time, just let the superintendents answer that. I think it's going to be a school-to-school possibly answer, so I don't want to get into those details. Thank you.
A lot of children rely on school and stuff for their meals. Is there going to be any kind of program or anything to help for now that schools are out? Because a lot of kids, I think, get their breakfast and their lunch, and a lot of times they rely on that. They rely on the school in order to be able to eat. So is there going to be anything to help them out during this time period?
Again, that's, specifics that I don't want to get into. That's for the school districts to, announce and roll out. But I know that there have been discussions about continuing those programs. That's something, again, that they are taking into account and consideration.
Okay.
And very, very mindful of. And I know there was discussion of that.
Okay.
Could one of the superintendents come to the podium and address these questions?
Okay, if we have a spokesperson that's comfortable speaking for the whole
We
group.
have all 13.
Yeah, we're certainly not going to bring all 13 up. I don't
Yeah.
want to get into specific school questions, but if there's something that he can answer for the group that's common, we can do that shortly.
Clark Godshall, District Superintendent of Orleans Niagara Bosse, has been working in conjunction with the local component districts. Each one is going to communicate with their community this afternoon and tonight in terms of details about food service, about medication return, and about completing some homework, some home activities. So that's all under development and will be rolled out. So.
Thank you.
Dr. Godshall, when was the decision made to close the schools?
We had to wait for the county to make this declaration.
Anything else? No?
How could people go about testing if ever need be?
Mr. Stapleton?
Yeah, testing is an important component of this. We want to know where the cases are. We want to know so we can identify those areas to mitigate any close contact. Testing right now is ramping up. The ability for testing is increasing on a daily basis. The ability to do sampling, which is done separately from the testing, is something we're working on as well. Talking with our local healthcare providers about how we can make that happen quicker and easier. Once again, people need to meet certain criteria before they'll be approved for testing. People can't just say, well, I'm worried and I want to go get tested. It's not the criteria that's followed. We follow CDC criteria to make those decisions, and all providers are aware of those criteria. But we have people calling us on a daily basis. We're giving them direction when we can, but that's something we're working on around the clock every single day.
Are you going to be doing drive-through testing like you're doing in the rest of the state?
Well, there's 1 or 2 counties in all of New York State that are doing it. We're currently under discussion with something like that, but it's still preliminary.
Where would tests take place? I know Erie County has their own public health laboratory where they're doing testing. Where is Niagara County going to be doing testing?
Well, there is no testing in this county. Most counties do not have a public health lab like Erie County does. So they're looking at Erie County Public Health Lab, came on last week. We understand that Roswell Park is going to be coming up on the next week or 2. They're waiting for equipment. Wadsworth Laboratory in Albany, the state public health lab, is doing testing. Quest and other private companies are doing testing. So, like I said, and I expect that will increase. Rochester is doing testing, not Rochester Department of Health, but I believe the hospital. So it's a lot of different people coming together, increasing the capacity for Western New York, and I think I'm very pleased with how quickly they've developed that. Getting the supplies and deciding how you're going to do that is equally important.
Becky, are there any plans in the works to close any public buildings on the county level, municipal level?
Not at this point. Again, this is a very fluid, evolving situation, and we, of course, will be in constant contact with each other as the situation escalates. Again, we still have no positive cases here in Niagara County. We have public services that need to be provided, and we're going to maintain those services. And if we need to have that discussion in the future, we will, but we are not there yet.
It seems this affects more so elderly people. Is there precautions or plans in place to focus more so on nursing homes and sites where elderly more so congregate and are in these closer environments?
Well, the governor has made it very clear, regulations have been passed so that people can't visit their loved ones in nursing homes. Once again, stopping the spread of disease means you need to make those really tough choices. So they're doing that. True, 80% of people who get the coronavirus, who get COVID-19 will have minor symptoms. It'll resolve on its own. We're making sure that the 20% who can have negative impacts from it are taken care of, are prioritized, and that's why difficult decisions like nursing homes are implementing right now, and assisted living centers are implementing right now, and senior apartments are implementing right now, are ways that we're going to make sure that that population stays healthy and protected.
Of those individuals quarantined in Niagara County, how many of them have actually been tested? Because I know not usually everyone does.
None of them have been tested. And usually, that's not the case. Most people are not tested. The quarantine is to make sure that that the public is protected, that their family is protected, that they're protected for those 14 days. We have an individual who has gone through the 14 days, and it's fine. Those 14 people are asymptomatic. They do not have symptoms. That's important. We do not have people under quarantine who have symptoms, and most likely they will not develop those symptoms, but we visit them twice a day, every day, to make sure that they don't develop symptoms, things like temperature, cough, those types of things.
With the sports leagues and that saying that they were going to reevaluate in 30 days, it seems like a lot of people were thinking that in a month, 6 weeks, that maybe this would be more under control, that maybe things would get back to normal in that. But it seems like your timetable is a little bit longer than that. Are you thinking that cancellations, postponements, things like that are going to now probably extend into the summer?
We just don't know that yet. It's too early to say that. We have to see how things evolve over the next few days and when that first positive case happens. Again, very fluid, ever-changing situation. We will continue to keep you updated. Again, we thank you all for coming today. At this point, we are going to end the press conference, but if you have additional questions and you would like to stay around, we will, of course, be here to answer those for you.